Good afternoon, everybody. Welcome in this THCS info webinar. It is 3 o'clock at the moment, but there are still people coming in. So welcome to you who are just joining us. We give everybody the opportunity just a few minutes more to enter the room so that most people are in. So please, we ask for a few moments before we officially start the webinar. In the meanwhile, you already see it on the screen. If you enter the room, please mute your microphone because we are with many. So let's try to have some kind of discipline on muting ourselves so we don't have any disturbing of noise during the webinar. Thank you. For the ones who just entered, welcome to this webinar. We just wait a few minutes more to give everybody the opportunity to join the online room. Thank you. Okay, welcome everybody to this webinar. It's 5 minutes past 3, so although there are still people coming in, I see, we would like to start officially now with this webinar on the THCS Call 2024. Welcome, my name is Rick Wisseling. I'm one of the members of the THCS Call Secretariat. And on behalf of the entire team of THCS, we welcome you very much to this webinar. Maybe some rules before we start diving into the call itself. Since we have a few hundred people inside this room, we all ask you to please mute yourself so to prevent any disturbing noises during the webinar. And next to that, there is a chat. However, you can raise questions, of course, in the chat, but be aware there will also be a Q&A at the end of the webinar. So after all the presentations, you get the possibility for questions. What we ask you is to, if you have questions, then please put them in the chat. We won't answer the questions in the chat, but we will take them afterwards during the Q&A. We will see which questions are most asked, let's say, in the chat, and try to answer as many as possible. For the ones that we cannot answer during time constraint because of time constraints, we will make a Q&R, frequently asked questions, and put this on the THCS website. So even if your question might not be answered during the webinar, you might find the answer on the THCS website in a few days. So on thcspartnership.eu, you will find a frequently asked questions document in a few days uploaded. So you can see the chat as a kind of mailbox to collect all the questions that you have. That being said, I think we can now officially dive into the program of today. Let me see if you see my screen. I hope it works. As said, this webinar is about the 2024 THCS call, and the topic or the title of the Transforming Health and Care Systems call this year is Innovate to Prevent, Personalized Prevention in Health and Care Services. So that's the topic. You will hear more about it today in this webinar. So just to take you through the agenda, we will first start with an introduction on the Transforming Health and Care Partnership in general. So you will get some more information on what it is about and its aim and how it is shaped. This will be presented by the coordination team in the person of Federico Bastarolo. He will present shortly the partnership. The next topic will be the explanation of the call topic itself. So more on what is the call about and what are we looking for in terms of applications. And this will be presented by Justin Holmgren, and he's one of the developers of the call text and coordinating that process. Then the next topic, we will dive into all the procedures and the criteria of this call. I will present this part on behalf of the call secretariat. Then afterwards, you will get a short explanation on the partnering search tool that we have for this call. So that's an online portal that can help you to find other consortium partners in shaping your proposal. This will be done by our Polish colleague, Marcin Szymleski, and he will present and show you on the screen how this tool works and how it can be used. And finally, as promised, we'll end up with a Q&A, so a question and answer session, in which we try to answer most of the questions that you have raised in the chat today. So that's the program for today. And that being said, I would like to hand over the floor to my colleague from the coordination team, Federico Bastarolo. The floor is yours, Federico.
Hello, good afternoon, everyone. I'm Federico Bastarolo from the coordinating team. I follow the communication activities of the THCS project. And we want to start today by showing you the video that we have developed within the communication activities, which will sum up a little bit for you what is THCS, the main objectives, and how it works. So let me share my screen and we can start.
Health and care systems in Europe are facing core common challenges which require harmonized and coordinated solutions. The swift evolution and aging of our society, coupled with health crisis, demand countries to effectively address the growing pressures on their healthcare systems and deliver top-notch health and care services. Moreover, these systems face similar hurdles that necessitate unified and cooperative strategies, formulated through a procedure that enables all individuals concerned with health and care systems to design, investigate, and execute solutions promptly. The European Partnership on Transforming Health and Care Systems is a co-fund action under the Horizon Europe program, designed to support coordinated national and regional research and innovation programs, along with capacity building, networking, dissemination, and other key activities to support health and care systems transformation. Led by the Italian Ministry of Health, the THCS partnership involves a grand total of 63 entities, comprising 23 member states and HE associate countries, as well as 3 non-EU countries, Switzerland, UK, and the United States, from a total of 26 countries. Additionally, 9 regions from Belgium, Italy, Portugal, Spain, and the UK are also a part of THCS. The general objective of THCS is to contribute to the transition towards more sustainable, efficient, resilient, inclusive, innovative, and high-quality people-centered health and care systems equally accessible to all people. For this purpose, THCS aims not only to create new knowledge and scientific evidence, but to co-design new solutions and support their transfer and scale up across countries and regions, while also fostering capacity building. The approach for a successful and smooth implementation of THCS will focus on 3 main work streams: filling the knowledge gaps with research actions aiming at providing the necessary evidence; implementation and transfer, aiming at supporting actions focusing on the testing of existing solutions and adaptability in different national and regional contexts; and boosting health and care systems through dedicated activities, capacity building and trainings, study visits, technical assistance, twinning, networking, involving different health and care stakeholders. The European Partnership on Transforming Health and Care Systems will pursue its specific objectives through the implementation of 4 pillars and 10 highly integrated work packages. The partnership will foster synergies with other EU and Horizon Europe initiatives, starting from the calls of the cluster health and then partnerships and mission, either in terms of its design, implementation, and funding. By building synergies, the partnership will be able to define complementary actions, preventing duplication of efforts in order to achieve bigger and wider objectives. Why partner with us? Become part of the THCS community and collaborate with a network of over 63 partners. Be involved in transnational collaborative research and innovation projects. Gain access to new data, methods, models, and innovative tools for healthcare system transformation. Promote clear communication between scientific, regulatory, and stakeholder entities. Support the development of efficient, equitable, and strong healthcare systems for all. Each of us can make a difference. Together, we make change.
So this was our presentation. Let me share again my screen now, just to complete. Sorry. Let me share my screen again. So to round up what was said before. So here we go. Yes, first of all, as it was not mentioned in the video, just for you to understand where we are in the European research and innovation landscape, THCS is co-funded by the European Union and is it's one of the partnerships that are included in the cluster health of the Pillar 2 of Horizon Europe. So you see, we are here. As said in the video, we are a large partnership. We have 63 members coming from 23 countries around the world and 9 regions. We started officially our operations in January 2023, so now we just passed the 1-year mark, and we are going to continue for 7 years. Pillars and work packages. This might be interesting for you to know how we are organized internally. We have a pillar 0 that is our horizontal program management, and then we have 3 pillars. The central one, the one that actually today will present his activities, is pillar 2, the one that is about funding research and innovation for health and care systems transformation. We have 3 work packages working in this pillar. But then we have other 2 pillars on the side that are helping to sustain our holistic view for the transformation. One is for translating sciences and innovation into policy and practice. So we have 1 pillar that is one work package, work package 4, which will be in charge of assessing the trends and the needs for research, development and innovation in healthcare system transformation. And then we have another important work package, that is work package 5, that will help us bridging this scientific evidence that we are going to find during our 7 years endeavor into policy. So we're going to try also to have a direct communication with policymakers at European level. Also, pillar 3 is very important because we're going to be working within this pillar on strengthening ecosystem in Europe. So really focusing on a systemic approach to transformation, not to leave it just in health and care systems, but to promote a more round-up transformation of our systems. And then also very important part of our partnership will be the knowledge hub that we're going to create, that will be online by the end of this year, in which we are going to collect all the evidences and best practices that we are going to identify and fund, obviously. And it's going to be open to the whole and wider community of European researchers to draw inspiration. THCS approach, maybe I will not repeat this as it was well explained in the video, but yes, as you've seen, it's about filling the knowledge gap, implementation and transfer of validated solutions for large-scale piloting, and then boosting health and care systems through capacity building, study visits, and so on. Which are the expected outcomes? Obviously, we want to aim high. We want really to try to build stronger local and regional ecosystems. We want European researchers, as you are, that are engaged in a wider collaborative research at international level. We want health and care authorities and policymakers to be ready to use the research results that we are going to feed them. We want to promote better cooperation. We want the investments to be efficient and evidence-based. And we want also health and care providers and professionals to be ready to implement the innovative solutions that are there to be implemented. Few figures in terms of funding. Our total budget is quite high. It's more than 300 million euros. Part is contribution in cash by the funding entities. There is a contribution in kind, and there is a contribution from the European Commission which is 30% of the total. All the rest is from the research institutions, from all the partners, authorities that are within the consortium. Last year, we launched our first Joint Transnational Call. The name was Healthcare of the Future. We get 36 funders and more than 30 million euros as budget. And this year, we have our second one. That is why we are here today, to learn more about our second Joint Transnational Call, Innovate to Prevent. We have even more budget this year. We have around 34 million euros. So there will be plenty of opportunities for your research ideas to be funded. We are very happy to have all this interest from your side today. So we hope that you are going to enjoy this webinar. And if you're interested in THCS, please don't forget to follow us on our social media. You can find us on LinkedIn, which is our main channel in which we are going to disseminate all relevant information, like webinars, opening of the calls. We have a call for expert as well, which is open currently. You can find us also on Twitter. On our website, everything is there. So all the official text and official information, you can find it on our website. And also you can drop us an email at coordination@thcspartnership.eu. I guess this is it from my side. I don't want to take more of your time. So thank you very much and have a good webinar.
Thank you very much, Federico, for giving this general overview of the THCS program. I would now like to dive into more the call specific of this year, because I think that's where you're all interested in. So our Norwegian colleagues, Siv and Jostein, are ready to take you through the specificities of this call and the topic, and to give you more insights into that. So the floor is yours.
Thank you very much, Rick. As Rick mentioned, my name is Jostein Holmgren, and this is Siv Øverås. We're both representing the Research Council of Norway. Although in the THCS partnership, we are part of the Work Package 6, responsible for the drafting of the call documents, and in particular, the call text. The title of this year's call, as you've seen, is Innovate to Prevent, Personalised Prevention in Health and Care Services. And I want to dig into straight away so what that entails. I will skip over this slide as our colleague in the coordinating team covered this. But here we have what you could call the ambition or the mission statement of this second Joint Transnational Call. It addresses the need to improve the implementation of personalised prevention strategies in health and care services. So I've highlighted these three terms: implementation, personalised prevention, and health and care services, as these three are really core to what we want to achieve in this particular call. First, implementation. It is crucial for this particular call that all the projects have outcomes that are either close to implementation ready, or have a clear plan to reach implementation. Secondly, you have personalised prevention. Now, this is the thematic priority in this call. I will get into more the details of what we mean by this. And then third, health and care services. Now, it is crucial within the umbrella of the THCS partnership that we are talking about initiatives that are in health and care services, be it organizational models, etc. These are not clinical projects. I will get more into that as well later on. Now, the second half of this sentence relates to the aspect of digital and IT technologies, and that is sort of the second half of the topic. So you have personal prevention as the thematic priority, but then you have IT and digital-based technologies as the structural priority of this call. So while it is not a absolute requirement to include IT and digital-based technologies in your proposals. We want to acknowledge in this call that any meaningful effort to introduce organizational models of health and care services need to relate to the digital world we're living in, and that entails existing IT and digital-based technologies. But also to highlight the word existing. So this call is not about developing any new technologies. It is about using the technologies that are already mature in supporting prevention strategies in health and care services. The ultimate goal is to improve the health and care systems dimensions of quality, efficiency, equity, and sustainability. And these dimensions are important to keep in mind when you are writing your proposals in terms of what project outcomes can help support in health and care systems. Digging a bit further into the aspect of prevention. So in this call, we are explicitly not including primary prevention in the scope. Now, the reason for this is that within the scope of THCS, we are interested in projects that lead to measurable outcomes in a relatively short time span within the lifespan of the partnership itself. And for that purpose, many primary prevention initiatives have much longer and much more difficult to measure outcomes. So for this particular call, we are not including primary prevention. We are, however, including all the other levels of prevention. That includes secondary prevention, tertiary prevention, and quaternary prevention. Specifically, actions that build up, implement, and upscale organizational models with the support of existing IT and digital technologies, as mentioned. For those who may not be aware, secondary prevention involves disease prevention. Now, that can be done in many different ways, including predicting, reducing, delaying, and avoiding the development of diseases. And examples of this can be vaccine programs, it can be screening programs, etc. Tertiary prevention involves the management of disease that has already occurred. It involves reducing worsening of the disease and improving the efficacy of therapies, as well as preventing complication of further damage. And finally, we have quaternary prevention. This is perhaps less well known than the others, but this also relates to preventing further harm. In this case, harm from over-medicalization, and particularly protecting patients from unnecessary interventions, and suggest ethical alternatives to current interventions. We have some essential elements that all proposals should or must include. The first, as I've been alluding to, is that we are looking for proposals that generate new knowledge, but also implementation-ready solutions. Proposal must address both economic and social impacts of the proposed model, solutions, or approaches. Proposals are required to address legal, financial, technological, and educational barriers to implementation. Proposals are also required to address necessary skills required for all relevant stakeholders. These can be medical professionals and clinicians. These can be end users, patients, next of kin, etc. Proposals should also address how end users will be involved in project. Again, end users here will depend on the project specifically, but it's whoever the persons who will use the outcome of the project. That could be clinical personnel, professional personnel. It can also be patients, could be next of kin, etc. Proposals must show how the project will be linked into the wider policy context and ecosystem. So this relates to the project not standing, in a vacuum but rather being part of a larger system and seeing how its outcomes relate to the broader systems where they are to be implemented. And finally, and this is particularly important for implementation approaches, is relevant industry and end user organizations should be partners in those consortia. Moving on to the types of research and innovation activities that are included in this call. So we are looking first at validation, customization, and adaptation of innovative health and care prevention models. Here again, relating to IT and digital technologies, and also data sources. And finally, how these relate to medical technologies in prevention strategies. Next, we include demonstration and pilot activities and for implementation, improvement, and transferability. And crucially, again, here we're looking at preventative practices already identified. We are finally including proof of concepts for the efficacy of implementing new preventative models. Following the same theme, we're looking for immediate and probable application for prevention strategies, and demonstrations of how these can be upscaled and promoted in prevention models, and again with the integration of IT and digital technologies. So as you can see, while I said initially that it's not an absolute requirement, it's a running theme to include IT and digital technologies as a perspective in your proposals. The activities should address barriers to access, particularly for vulnerable groups. This could be, for instance, elderly or migrants, etc. There is also a barrier that is particularly crucial to address, is how to foster a receptive culture among end users and stakeholders. A lot of the time you have challenges implementing solutions in health and care systems and services because there's a resistance in the workforce culture among the patients to adopting the proposed solutions. We want to highlight ensuring and reinforcing trust in health data for public health resources, or purposes rather, and this is crucial in terms of having a system that the broader population can accept and trust. We want to focus on the workforce and the impact your proposal has on the workforce where we're implementing the models that you propose and how it affects the workforce. That can be in the short term in terms of what is required by the workforce in terms to put your solutions and outcomes into practice, but also longer term how your proposals will lead to a reduction in burden on the workforce. Proposals can lead to can output standard measures and indicators that can improve health and care data use in prevention strategies. And finally, you should include the end user's perspective in your proposals, particularly in how the project outcomes can be used in the establishment, implementation, and upscaling of prevention models. Now we have a short but important list of rejection criteria. First of all, proposals that primarily or predominantly consider development of new technological solutions will be rejected. This is, as I mentioned before, we're looking for existing IT and digital technologies rather than development of novel technologies. We will also reject proposals that have a predominantly clinical or a preclinical or biomedical component. These are the proposals in this call should have a health and care systems and services approach. Proposals that are purely epidemiological, just mapping that are concerned with mapping the extent and causal factors behind illnesses are not included. And also proposals that concern solely social and welfare services, but do not address issues in health and care services. So they can be addressed, but not as the only area of concern. Proposals that do not take into consideration an eco-wide system approach or fail to consider end users' perspectives are rejected for this call. And finally, as mentioned previously, we are not including proposals on primary prevention actions in this call. Now I will hand over to our colleagues in the Joint Call Secretariat, particularly Rick, who saw in the beginning, who will go through the more formal procedures for the call. And if you have any questions regarding the topic of the call, you can contact either myself or Siv at these email addresses.
Thank you, Jostein and Siv, for taking us through the call topic. I saw already a lot of questions popping up, which is understandable. Maybe one thing to add before I dive into the procedures and the criteria is that we are recording this webinar, so it will be put online on the THCS website afterwards, so you can have a look at it again and see all the information on your own pace again. So that's good to be aware of, and otherwise we could also share the slides too. So you know that this there will be an opportunity to see it again. Let me now dive into the topic of the criteria and the procedures. So we are here now. It's bullet number 3. Okay, maybe to add a little bit on the story of Jostein, saying that what is important when it comes to THCS projects, and I think there are 3 quite important elements which are already touched upon, but I think try to repeat them again, is that if you are talking about transformation, this is not an easy process, and this is something you cannot do on your own as one partner. You need a whole bunch of stakeholders. So that's why stakeholder involvement is quite, I think, crucial. And we are using the word ecosystem approach because if you look at health and care systems, there are so many players active in this field that it's a kind of, and they're all intertwined somehow. So you can say it's a kind of ecosystem. So that's why we say it's good to take a look at your innovation or your intervention and see how that fits into the wider ecosystem and which stakeholders you need to involve there to make it successful and to eventually make sure that it contributes to some kind of transformation in the health and care systems within Europe. As said already, transition or transformation is an important word. So in any case, your project should contribute to this transition. It might be on sustainability, it might be on efficiency or equity, or you can choose on several aspects or only focus on one. That's up to you. And of course, it's always done in transnational collaboration. That's because this challenge is not only happening in one country. This is a challenge we all, so let's say many countries face at the moment, how to make sure that our health and care systems are also well equipped for the future. Then some more details on the procedure. So this call is a one-stage call. In that sense, it's the same as last previous call. As you maybe already have seen, we ask consortia to submit an intent to apply, which the intent to apply form is already on the THCS website. You can see what we ask from you and what you should fill in there. Just to give you a general idea, this intent to apply is a kind of, for us as a partnership, to know how many proposals and on what type of proposals we can expect. So this helps us also in the recruitment of the reviewers to make sure that there's a good match between the knowledge that they have and the proposals that you send in. So that's the reason why we ask this intent to apply. And you should have an intent to apply submitted on time to be eligible to submit the full proposal afterwards. Durations of projects can, on the shortest term, be 12 months, up to 36 maximum. The proposals will be checked when they are sent in, the full proposals, on the eligibility of all the partners. In case that a partner might be not eligible according to one of the national or regional rules of a funder, it might be that a project drops off because it's no longer living up to the criteria that we have. So that's good to be aware of. And additionally, and I think this is very important, so it will be repeated several times, I think, during this webinar, that please check your national or regional eligibility criteria for your funder. So for instance, if you are from Belgium, there are several Belgian partners. So please make sure for which funding agency you would apply, and check their national rules and see where what these rules are, and that you are in compliance with those rules. You can find these eligibility criteria in the call text, and they are in Annex number 1. So this is the place where you can find all the eligibility criteria for each funding agency that is involved in this call. Then, on the composition of a consortium, the following rules apply. So there's a minimum of three partners from 3 different participating countries that have to be in one consortium to be eligible, up to maximum 9 partners, which is the maximum that we allow. However, there is an exception. If you are integrating patient organizations and/or can be both companies, we allow you to extend this number of 9, so you can have more partners if you include patient organizations and companies. Otherwise, if you don't, then you are bound to the 9 maximum. As being said, these 3 minimum partners have to come from 3 different participating countries in this call, from 3 different participating funding agencies. So that's also a good thing to take in mind. There's a maximum of 3 partners per country. We have decided so because we would like to have a kind of good spread from in a proposal, that it's, let's say, represented in all the participating countries very well, and not only major balance, let's say one country is overrepresented in the proposal. There is the possibility to add self-funded partners, can be maximum 2, and these are also on top of the 9. And these self-funded partners, all, like the word already says, join on their own budget. So these partners can also come from countries which are not participating in the call. However, be aware that these self-funded partners cannot be a coordinator or become a work package leader, because there will be a huge role to take up, and they don't have any funding there. So that's something that we did not allow in this case, because it might bring the project at risk. So that's the reason. Another important question that is asked: are we able to hand in several proposals? And then we have said that the same applicant can only be project coordinator of one funded proposal submitted to this call. However, you can, as an applicant, as a principal investigator, join 2 applications. So 2 is the max that you can, as a person, can join on one on this call. And again, I think it's also good that on these rules that are set here, there might be some additional rules. For instance, like we have stated here, 3 partners per country, but it might be that in some countries it's only 1 partner per project that can be funded. So this can vary from country to country. So please check the national or regional rules on this in the Annex 1. And then we go to the next one. Some restrictions here too. As already said, a collaborator party cannot act as a project coordinator or work package leader. As already also stated, 1 applicant can submit maximum, or 1 person from 1 entity can submit maximum 2 proposals, and you can only be coordinator in 1 of them. And another, that's a practical point, which is also very important. When you start handing in your submission online in the portal, be aware that after you have sent in the intent to apply and put the coordinator there, you cannot change the coordinator anymore in the full proposal stage afterwards. For all the other partners, you can still change, and all other kind of information, there's still the opportunity to change or add things after the intent to apply stage. But this is not the case for the coordinator. So that's the only exception which is fixed. And be aware that you have to reuse the same login account for the person who handed in the intent to apply to also hand in the full proposal. So it's very good to think before you link, let's say, that's how we put it, to think who is actually handing over the proposal, because that is the email account that is also being used for the full proposal in the end. So that's something you cannot change after the intent to apply stage. And again, I cannot repeat it too often. Check the eligibility criteria for your national and funding agency for all specific details on restrictions they might have. Then we go to the call criteria. On the evaluation criteria, there are three main criteria on which the reviewers will assess the quality of your proposal. So first, on the excellence, so they will look at how relevant is your proposal for the transition and the transformation that THCS wants to bring about, and what is the need for your project. So this should be very clear. Secondly, it's on impact. So this is showing how your project is making a difference in practice. So what is your project going to bring about, and for whom is this going to be a benefit? So this should be clear from your proposal. And the last criterion is the implementation side, and that is about showing how you execute the project and how it is managed, so that the reviewers can see how you plan to do everything within your project. So that's on the criteria. Then we move to the more practical side of things, the submission platform, which is the platform in which you have to submit your intent to apply and afterwards the full proposal. This is just a small screenshot, as you can see, and I highlighted it in yellow. It's not very big, but on the bottom of your screen, you see there is an option for ask for help, and there is a frequently asked questions page. So if in case you got stuck in the system or something is not working, or you bump into any kind of problem, you can press on the ask for help and you get the opportunity to make use of the help desk. That will allow you the opportunity to raise your question. And just to give you an idea, this is also another screenshot how it looks like. So you'll get this kind of ticket you can submit, and there you can put in, say who you are and what your question is, and then the team will try to come back to you as soon as possible and to answer your question. And so hopefully you can continue with your application as soon as possible. So this is a way to get help or assistance in case things are not clear or technically you have any issues. Then the timeline. When it comes to the first stage, which is the intent to apply, which is already on the website, on the THCS website, you can find what we ask for the intent to apply. The deadline for handing over this intent to apply is April 16 on 2 o'clock Central European time. So then is the deadline, and we are quite strict in that regard. So intent to apply after the deadline will not be considered anymore. And then the second stage is finishing the full proposal. I saw already people asking very correctly, of course, for the project, the full proposal form. And the last details are fixed now. So hopefully it will be today or maybe tomorrow that the template with the full proposal will also be online. So you can see what is requested from you for handing in the full proposal. Both the full proposal and the intent to apply have to be submitted in the online tool, and you can work in it, and it saves also the things that you are doing when you have added something to the system. But however, be aware it's always good to take a little bit of space before the deadline, so don't wait until 1 minute before when everybody is pushing for it. I know it is hard and it's hard work, so we know that this happens, but if you can avoid it, please do so, because it saves a lot of stress and potential technical problems which might put you, let's say, in a bad place. So if you can avoid it, then please do so. Then when all the proposals are handed over, and then there is an opportunity for rebuttal for the project coordinators. So I think it's important for the coordinators to put it in mind that you have 1 week in August. We know it's in August, but given the planning, we try to be as fast as we can. It had to be in August. And you get the opportunity to see all the reviews that were done by the independent reviewers, and you can comment on that. You get a page, let's say, more or less, to give your comments, and if you see things in the application or in the review of which you think they are not correct or not well understood, or maybe potential questions, that could also be the case, you can react on that during the rebuttal stage, so that the reviewers can take this into account when discussing the proposals during the panel meeting. Then after the panel meeting has taken place, we and all the funders have come to an agreement on the final funding list. We will communicate the results in October, so that will be the month of in which you can expect the results from this year's THCS call. When all this is done and you get the results and your project is rewarded, in that case, the earliest you can start is probably December 23, but that's quite soon. And most of them will probably start in the spring or beginning of, sorry, it should be 25. I see 24, but that's not correct. It should be December 24 and May 25. Excuse for that. To start your rewarded project. So that's more or less the timeline from handing in an intent to apply to potentially, or maybe your project to be started. Then before we move over to the questions and answers, I already said that we have the opportunity to show you a partnering tool, because I saw also questions on how do we find the right partners to collaborate with, which is of course very important. So that's why I would like to hand over to my Polish colleague Marcin, and he will present the partner search tool that we have in place to help you with finding the best partners for your project proposal. Marcin, the floor is yours.
Okay, thank you. So my name is Marcin Chmielewski, and I'm a part of the call secretariat team, and I'm representing Polish founding agency NCBR, so National Center for Research and Development. And I will now show you my screen. Okay, so I hope you see now my screen. This is the application called Part Finder, and this is the tool that will allow you to search partners or to search projects that are available through this call process, and also on other call processes in our programs, or other programs or calls, because this tool is universal. As you can see here on the main page, you can see the announcements. I created this one as a test announcement. We will see it shortly. And as you can see here, you can go through all the active and existing announcements. You can check who is looking for what. You can also filter this page by all these announcements by type of collaboration. So you can find a partner or project that is looked for. You can pick the announcing country. You can check this or pick the status of the proposal or application. You can also pick the proper classification area. This is based on Polish OECD system. It's 6 major topics with a few subtopics each. So it will also allow you to find the project that is mostly covering your needs. And what is very important here, this filter, this is a filter by which you can change or pick the proper programs. So I will encourage you to pick THCS partnership. So we also only see the announcements that are dedicated to THCS program. We have in total 113 different applications or announcements, but more or less 30 of them are still active and dedicated to this second call for proposals. And yeah, so please pick the proper filters. And if you would like to see the details of these proposals and to make contact with the author of the announcement, you will need to create an account, because without it, if you click on the interesting, oh, sorry, I need to log out. If you click on the interesting proposal, you will just see this. So you will be forced to create an account. It is a very simple process. You just need to like here pick an email and a password, and you will be ready to go. So if you have one, of course, you will receive the confirmation email. So please click it, and you will be transferred to this page, and you can log to your freshly or newly created account. You will see probably this screen. So you can change the information regarding you. So name, email, username, title, etc., etc. You can also start creating new announcements. You can choose announcements from the main page to be your favorite. So if you are on the main page, you have a few additional options. You can check the details of the proposals. You can make the proposal or announcement favorite, and you can also report some violations if you see one. So after login, if we click on the name of the announcement, we will see something like this. This is the details of this announcement. We can see here the title, partner name, type, program call, or call name. You can pick also many different programs for your announcements if you're interested in, and also you can check the work description, achievements description, keywords, etc., but also contact details. So you can find here the contact details to the person that is responsible for this announcement, or is the contact person for this announcement. And through email or phone, you can contact with this person and start the collaboration within the THCS call for proposals. And to create your own announcement, just click this button, new announcement, and this tab will show up. So again, please put here the project title, type of collaboration, your name or name of your institution, type of your institution, or for example, institute or other things. And also please put here the work description, achievements description, any information that you will need, you think that is valuable for potential collaborators. You can put this the information here in those two boxes. And of course, don't forget to pick the proper call. So THCS partnerships. Also, you can pick more if you're interested. So you can just look for additional partners in a few different calls. Also, countries, keywords, and additional information. And don't forget to put the info regarding the contact person for this particular announcement. And on the left, you have a menu with the profile, with your announcements, so announcements that are visible or just newly created. If you create an announcement, it will be change it in this form. It will be ready for publication. It is not published yet. To publish it or to make it visible for other users, to be visible on the main page, please don't forget to click this publish button. After this action, like now, this announcement will be visible on the main page. So every interested potential participant can contact you and find your information. And also on the left, you can see my followed announcement. So every announcement that you pick to be your favorite one will be listed here. So you have fast access to all those proposals, and you also can check the details of each of them. Yes, so, and again, also you can change password and email if you want to amend it in some way. So yeah, this is very general information. The tool is quite simple. We hope that you will be having no problems using it. If you will find some issues or problems, so please don't forget to contact us at this email address, pathfinder@ncbr.gov.pl, which is here on the last slide. So yes, thank you very much.
Thank you, Martin. This is, I think, a very helpful tool for you to find, hopefully, good matches for your proposals. I think it's exactly 4, so we have more or less half an hour left for mainly questions and answers, so that's, I think, quite good in terms of time. Maybe before diving into the questions, is it not? Let's go through it all the way. Like I already said, I think for more info and contact, I already show you this. So I think most of the information, so the tool that was just presented to find partners, the template of the intent to apply, the full call text, all this information can be found on the THCS website, so thcspartnership.eu. So if you have not been there, please take a look there, because there is most of the information that you need at your disposal. Then if you want to stay up to date on what is happening within the partnership, then LinkedIn can be very useful to subscribe yourself to the THCS LinkedIn group, so you will get some announcements of activities or other things that pop up. And next to that, if you have any specific questions regarding the call, so it's not these technical questions, let's say, there you can use the help desk as was presented during my presentation with the ticket that you can create. But if there are questions outside of that, you could contact THCS at Zondermeet.nl. That is the address of the call secretariat. So you can put questions to the call secretariat to that email address. That being said, let's dive into the questions and answers, because there are a lot of questions I saw in the chat. So I will stop share my presentation and dive to the questions. I try to start from the top and then see how far we go down, or the questions that are listed or thumbs up several times. I think that's of interest to more people. So the first question that I encountered was on English partners. Scotland is involved in this call. However, the UK, let's say, or England itself is not involved as a funder. So English entities can participate, but only as self-funded in this case, unless they are established also in Scotland. So if they have an establishment in Scotland, they might ask for funding through the Scottish funder. If not, you can only participate on your own funds. So you can join, yes, but on your own funds. So that's the answer to the question for English participants in this call. Will we be able to receive the full proposal? As being said, hopefully today, but probably could also be tomorrow. The full proposal template will be shared on the THCS website, so you can see what is in there. Okay, I think this is also on UK, a lot of questions. Some people are not able to find the Twitter. Maybe, I'm not sure I have a good answer to that one, but hopefully it's already figured out, maybe because I see some responses there. I see that there was a question from Fiona. Are there lessons learned from the first THCS round that can already share with us? Maybe Fiona, this is your opportunity. If you're still with us, can you explain a little bit what kind of lessons you are looking for, so I can better answer your question?
Hi, good afternoon. I'm
Good
still
afternoon.
here. Yeah, I was just wondering, because this is the second call, and I heard like the process, choosing projects. I knew some deadlines were missed last year. Are there some lessons learned from that, and also for new applicants to that you want to give some advice for us?
Yes, we learned a lot of lessons. That's the first general answer to your question about doing things a little bit differently. So we, for instance, with the rebuttal stage, we try to change that a little bit. We also squeeze the, let's say, the planning a little bit. We shifted it a little bit more to the front so that we have more time for the reviewing period, for reviewing your proposals properly. So that should help to get at least the process be run smoothly. When it comes to content, a lesson that is learned, or what we saw, is that the focus of many proposals on what you contribute to some kind of transition of the system. So how is your proposal going to adds to some kind of transition or is going to improve or help to make the system more sustainable or better in terms of quality or more efficient. I think that is something that could be more explicitly written in the proposal. So I think it's good to focus very much on, to have that in top of your mind when you are writing the proposal. So I think that is a lesson that we did draw from last year, that it sometimes is very specific on the topic, but it doesn't give a bigger picture on what is that specific intervention or innovation is going to contribute to this transformation that we would like to see in order to make sure that the health and care systems are also equipped for the years ahead of us. So I think that is something to bear in mind. Hopefully that answers your question somehow.
Yeah. Thanks for sharing. Thank you.
You're welcome. Then I saw somebody asking to define primary prevention, which is excluded from this call. So primary prevention, I think in this case would be then general health promotion. So that's something that is excluded from this call. So it's not within the scope of this call. We see there was a question, do you support hardware solutions in the implementing phase? Yes, I think we support, as long as it is the implementation of an existing solution that might fit to the scope of the call, yes. So yeah, this is also on prevention. Question on the evaluation process. How is it on the final funding? Is it based on the collective or on consideration of national funding agencies' interest? It is the reviewers, so the independent reviewers, that's come up with a final ranking list, and then it's the so they advise, say these are the best projects that we have on the list, and then it's the funding agencies that's in the end determine which ones they can fund, because they have not money for everything. So on the basis of of course the best projects, they start from the best ones and then you fund from there. So it's a bit of both basically. So the quality is done by the experts and suggested to the funders, saying these are the best to reward, and then it's up to the funders to see, okay, we have this amount of money, so we can only fund the first few probably, and not all of them, even though they might be of very good quality. So that's how it's done on the evaluation process. Do startups fit in this proposal? That's a difficult question. Companies might fit in the proposal, yes, but it depends very much on the funding agency. So some funding agencies might be able to fund companies, also startups, while other funding agencies in other countries might not. So this is something that you have to check with your own funding agency or the funding agencies within your country to see if they are able to fund a company. And a startup might also be, it depends on the level, of course, of their innovation or product or whatever service that they have. It should be mature enough that it's already an existing intervention or innovation that is already being used. So not something to build from scratch, because that's not what this call is, not about developing new solutions from scratch. Something asked about this is something very specific, but it's, I think, there's a question on maybe the Norwegian colleague can answer. The question is, how is it linked to the current Prevent CD led by Norway? Shall it be additional or complementary topics? Maybe Justin and Steve, does that ring a bell for you?
We do, in the drafting of the call, we do consider competing initiatives. It's difficult to fully consider every single initiative that's going on in Europe, but that's part of what we consider. I'm not familiar with that specific joint action, even though it is led by Norway. It's not something I'm directly involved with. However, to the extent that it is overlapping or complementary, that is, when we write the call text, we are representing the whole of THCS, not just Norway. So it's a balancing act between many different initiatives and some overlap is it's unavoidable. I think that's the closest I can get to a clear answer.
Okay, thank you. That's helpful. The question is on SMEs. As being said, SMEs can join a consortium. Yes. Can there be coordinators? That depends. If they are really a full partner in the consortium, they potentially could be coordinator. If they're only a collaborator partner, so let's say on a fully self-funded base, they cannot be a coordinator. And again, check your national or regional funding agency whether SMEs are eligible, yes or no, because this depends from country to country. Question on, is there a specific TRL level that the technology should have reached beforehand? I think we did not, but that's define a clear TRL level in terms of it should be 6, 7, 8. I think we said it should be an existing innovation or intervention. So the question, it should be used somehow, or has been used in practice somewhere. That is, I think, the main criterion that we said. So it's not, we didn't put a TRL level there, but it's a good suggestion. So it might be something worthwhile to reconsider to see if we should add a TRL level to that. But again, I think, like Justin already explained, proposals which are mainly on developing new solutions are excluded from this call. So that already tells you that this call is not about the development of developing new solutions, but it's about implementing existing innovation services and solutions. There's a question, are we expected to focus only on one kind of prevention, so secondary, tertiary, or quaternary, or are we able to have more than one of these? Of course, this is completely up to you. If you want to focus only on one of them, that is okay, but if you want to combine several, that's also an opportunity. So it's up to you what's best fits your purpose to choose whether you only go for one or combine several kinds of prevention. People are asking for where they can find the call text. You can find the call text on the THCS partnership.eu. That is the place where you can find the full call text. So with all the criteria and everything that was mentioned also by the people today that presented the call. Also, like I already said, we will record this webinar. So also the email addresses that were shown during the presentation, you can find them all back in the recording afterwards. So if you want, you can have a look at them again and see which people you would like to email specifically if you have specific questions for one of the presenters today. The question was, how do you evaluate the impact? I think the 3 criterion are scored with some numerical, so they get a score from 0 to 5, and 5 is the perfect score, of course, and 0 is like the worst score. That's how the reviewers give points to how well the impact was described in the proposal. And of course, I think what they will do is look at how you describe it and how tangible the outcomes are. So the more tangible you can make the outcomes of your project, is saying, okay, it's going to contribute to A, B, C, and D, for instance, or X, Y, Z, whatever. I think this helps for the reviewers to properly assess what impact you will deliver in the end after the project. And of course, it's good to be ambitious, but not also be aware that we cannot over ambitious is also sometimes not good. So it's a hard balance to find. The question is, how much fundings will be given by projects? Not sure what you meant by that, Helena von Granitz. Can you maybe elaborate a little bit on your question, what you meant by how much funding will be given by project? Is it per project or? Not sure whether you're still with us, Elena.
Hi, Rick. I'm here.
Hello.
Yes, hi. Yes, I wanted to elaborate on it since it's quite a complex setting with both partners of different countries, and the timeline is rather short. So in order to calculate on the possibilities really of funding a project like this on my behalf or my institution, I was interested to know about the funding range, how much for each project is taken, it's promoted, and I suppose it is, yeah, as was the answer to the question as well, that this is just depending on what country that you come from. So I think that was a bit self-explanatory.
Yeah, it's true. We didn't set a limit on central level, so to say. So it's
Okay.
depends on how much your country is. Most of the funding agencies have a maximum that you can ask for within as one project. So if you add up these for the different partners that are involved in your consortium, that is the total amount that you can get.
Okay.
So that it varies from country to country. So it depends. So for instance, some regions have a smaller budget than some bigger national funders from a bigger country. So there are quite some differences there. So again, yeah, it's good to take a look at your national or regional criteria and see how much you are allowed to ask from.
It was quite tiny actually. The Swedish funders was 15 million, I think, and that is not.
How much is that in
won't-
euros? Because that sounds a lot to all of us, I guess. But
yes, well, that would be 1.3 million euros.
the total budget for Sweden.
Yeah.
Yeah, it depends. Some countries have put several million in the pot. Others have put a few 100,000. So there are big differences in terms of how much money every country has devoted to this call. Yeah,
That's right.
it's something. We cannot change. Unfortunately, that is how European collaborations somehow works. But it makes it difficult. We are very much aware of that.
Thank you for asking, Rick. Thank you.
I see some people already making requests for partner search. You can also use the chat for that. It's also a way. It depends. Some people asked about the funding rates, and there again, I'm sorry, I'm repeating myself all the time. That also varies from country to country and per funder. So some funders have different funding rates than others. So please check your national or regional funder and see what the funding rates are for your type of institution, whether that is 100% or less. So. Let me see. Oh, good question. I have to say, are African partner countries of European countries eligible? I haven't had that case, but it's a good question. Let me come back to that one. I'm not sure. My first instinct would be that probably if they are collaborating on self-funding, it might be, but I have to check for that. We haven't had this in the first call, so we will come back to that question. Yeah. Question is, what is your definition of a partner, an institution, or a research team? A partner is, I think, is a legal entity. So in this case, it's an institution, because that is then the one that receives the money, and not a research team, because a research team is mostly within an institution. So it's the institution that gets will receive the money, or the institution that this person is working for. Hopefully that answers your question, Margot. Yes. Good question. There's a question about how many projects you are able to submit, and that is the question: is it the entity or is it the researcher who concerns this? And I think it's on the person level. So one person can only be coordinator in one project and can submit 2 projects as a principal investigator, so 2 maximum. But your entity, so it might be your university, for instance, because otherwise it would only be one person from the university that can apply. So the university itself has the opportunity to apply for other proposals then, but of course with another person involved there. So that must be somebody else from another department then. Yes. Question: does each partner in the project need to comply with the eligibility criteria of his or her country, or is this only obligatory for the coordinator? No, this is for all the partners involved in the consortium. They should adhere to the eligibility criteria of their funder. So that's all. That's why I keep repeating this so many times. This is key to make sure that you fulfill the criteria and you are eligible to go on in the next step of the process. Because if you're not, it turns out that after the submission of your proposal that it's not eligible, you will not be going to the review stage. So that's a pity of all the work that you are putting in and all the effort. So please make sure that you have checked this in time. Yes, the same question. Okay. Question: can you please specify proof of concept versus validation of the concept? I think the question is what is the difference between the two? I guess that's the question, isn't it? Anna, Besson? I'm not sure whether you're still with us. If so, is that, do I understand that correct?
Yes, so there we were discussing with the partners what's it's so close and we could actually tick both boxes, and we just wonder how is there any definitional difference so that we could really make sure that we're ticking the right box, because we could submit like an opinion there, and sometimes it's on the level really definition, back to basics, just to make sure we're doing the right thing.
Yeah.
Thank you.
I know it's a thin line, I would say too. So for me, the difference that would be then the proof of concept is more in trying to make it work in practice, while the validation is more like finding the evidence under the concept that you have. So that's, I would say, so one is more putting it in practice, and the other one is more when you have put it in practice, finding the evidence that backs up your concept. That for me, that would be the difference between the two. Hopefully that gives an answer to your question.
Thank you. If you put it in QA document, that would be really brilliant, I think, for everyone. Thank you.
Okay, thank you. That's well noted. So you should take that into the document. Yeah. Is it possible to subcontract some of the work? I think that also depends for the funders, the rules of the funders, but I think most funders, not all funders, but some funders do allow the possibility of subcontracting. So yes, that is an opportunity. Although it should be reasonable, I think there are boundaries. So you cannot subcontract like a huge, let's say, the main part of the work, because that would be strange not to include that subcontracting partner as a real partner. So there are limits, but yes, you can. There is possibility for subcontracting. Is it perceived as a pro point if the coordinator is a company, as it was in ALJPI? No, there are no specific criteria on giving a plus or anything on that, but companies can be coordinating. The others can happen. So it has happened in the first call for projects that are rewarded. So it is an opportunity. Is there a coefficient for the evaluation criteria? Not sure what is meant exactly by the coefficient. So Nicolas, can you maybe explain a little bit more what you mean by coefficient in this case, if you're still with us?
Yes, sorry, it's just to mention that is it more important, the implementation, the impact is more important than the other, or it's just or there is no coefficient on the scoring?
Okay, I see your point. No, all three elements are put equal, have an equal weight, so you get both. A score of 5 is the maximum for each tree, and there's no extra weight on one of the three criteria. So they are the same. You're welcome. Applicant, yes, already. Okay. Oh, the question is, who can be contacted if the national contact does not respond to our emails? In case you don't get a reply, please then email us as a call to secretariat. So you can send an email to thcs@zonmw. That's the email address I showed you in the end. I will show it again when we finish. .nl, and we will try to see if we can get in contact with the national contact person if in case that you don't receive a reply. Yes. Okay, there are many people doing a request for finding partners already, so scrolling to that. Will there be the same call next year? Oh, good question. We already started, just for your information, we also already started thinking on call 25 already. So we are working on that at the moment, we just begun working on that. So there will be a call 25. Whether it will be the same topic, that's not decided. So I cannot say whether that will be the case. I can say that there will be a call in any case. And we are trying to see if it can be a 2-stage call instead of a 1-stage this year. So that will be different from these two editions. But in terms of the topic, I cannot say whether it will be exactly the same topic. In any case, it will, of course, still be on transformation. So that's for sure. But the rest of the focus is part of the negotiations with all the countries that we are just starting up now. So as soon as we have more information, of course, then we will update you on call 25, but it will be only in the second part of this year. I think some do's and don'ts from the call. I already shared some with you. I think also technically, I think it's good, like I already said, that some people did experience some problems with the portal. So I think it's good to already start using the portal soon. So you get accustomed with it. You already have most of the information in, so you don't have to put in all the things at the last moment. I think that is a wise thing to do. So that's definitely something that we learned from the first call. And I think another issue or thing that is good to take into consideration is that, and I think Jostein already pointed it out in his presentation, that take a focus on also all the stakeholders that you need to make your project happen in practice to really start making that change. Of course, there's a maximum, so you cannot involve everyone, but you can make, for instance, a kind of advisory board or these kind of other, you can say that you have contacts with other type of stakeholders which are closely aligned to you. I think that gives an added value to your proposal to already take this into consideration when writing your proposal, so that you can show that you are already aware of the context around you. Okay. And like I already said, yeah, okay, that's already been mentioned. Co-funding, yeah, that's different. Like I said, it's different from funder to funder. So please check that in the Annex 1 of the call text, see on the national criteria. Okay, yes, some people try to register in the Pathfinder platform, but it say they need to activate the account. No email was sent. maybe Martin, are you still with us? Is there any delay, or could it be that it takes some time before you get the
Yes, probably.
activation email?
Yes, I would suggest to wait at least 2-3 hours maximum. If this problem persists, so please send us an email and we will check what we can do to help you.
Okay. So can you maybe repeat once more the email address for everyone if this might happen? So it's Pathfinder.
Yes, so it's Pathfinder at ncbr.gov.pl. You can find it on the main page on the bottom of it.
Okay, so if you see it on the homepage of the portal of the Pathfinder portal, you find the email address in case after, let's say, tomorrow you still don't have access.
Yeah. We will be able to activate the account in your name or just help you as an admin. So, yeah.
Okay. I think we have gone through a lot of questions, but it's already 4:30, I see. So the time is up for this moment. I think people might have other appointments. So I would like to round up here. And the questions that were not picked up, we will put them also and consider them for the frequently asked questions that we will put on the website in a few days. So even if your question was not answered, hopefully you will find it there. And if it's not popping up correctly, or you still have questions from after you've seen the frequently asked questions, then feel free, of course, to contact us. See if it works. I put this as a, so yeah. Oh. Okay, so for more information, please check the coming days also the website. Hopefully the full proposal will be available there. And if you have questions that were still not clear after reading all the material, then you can contact THCS at zon.w.nl. For all the technical questions in the submission tool, if you're in the submission tool, you can use the help desk function there, and you will get as soon as possible an answer from the help desk team. So that's for all the technical issues related to the help desk, but you'll find it once you log in there. For now, I want to thank you for your attention and for joining us. We will stop the recording soon and then try to upload in a couple of days, hopefully, the recording so that you can also have a look at that later on if you want to see things again. From here, I wish you a pleasant end of the afternoon and a good evening from all of us. Bye-bye.